The reconstitution of cytotoxic drugs stands as a critical and also delicate process within the realm of healthcare, playing a vital role in ensuring the therapeutic potency of this medication while simultaneously mitigating potential risks. Cytotoxic drugs, often employed in cancer treatment and other severe diseases, require precise preparation to achieve the appropriate concentration or administration. These introductory steps involve the meticulous mixing of these potent substances with specific diluents, demanding strict adherence to established protocols and also aseptic techniques. As the significance of personalized and target therapies continue to grow, understanding and executing the nuance of cytotoxic drugs reconstitution become paramount for healthcare professionals. This introduction set the stage for an exploration of the reconstitution procedure, safety precaution, and also the broader importance of these measures in maintaining the efficacy and also safety of cytotoxic drugs therapy.
Important of the reconstituent of the cytotoxic drug. Firstly is the drug stability. Reconstitution is performed according to the precise parameter in order to preserve the drug stability and prevent the degradation of the drug. Next is the correction of the dosage. Accurate dosage is necessary for the efficiency of the treatment and to mitigate the potential for suboptimal or excessive dosing. Next is integration with the administrative system. Ensuring compatibility mitigate the occurrence of problems such as precipitation or incompatibility reaction which may jeopardize the drug administration. Next is patient safety. Appropriate reconstituent is crucial for preserving the therapeutic index, which represent the equilibrium between obtaining the therapeutic outcome and preventing harmful side effects.
Safety precaution during cytotoxic drug reconstitution. The first one is personal protective equipment, which is PPE. Always wear gloves, gowns, and masks to protect against direct contact with cytotoxic drugs. The gown and masks are essential to provide additional layers of protection against any potential splashes or airborne particles. The second one is designated work area. Use, prepare, and sanitize designated space like biological safety cabinet or eliminate fluid to minimize contamination risk during cytotoxic drug reconstitution. The third one is adherence to guidelines. Strictly follow drug manufacturer and institutional guidelines to ensure the safe handling and preparation of cytotoxic drug reconstitution. The fourth one is aseptic technique. Employ aseptic technique including using syringe for delicate mixing and avoid visual shaking to maintain a sterile environment. Lastly, labeling for clarity. Containers and syringes are clearly labeled with patient information and drug details to prevent errors and to facilitate accurate documentation of the drug.
Next, storage and disposal. First, keep those toxic meds far away from other pills to prevent any unwanted mixing. For the serious stuff, make sure to store them in specialized cabinets or designated areas. Safety first. Next, when it comes to handling cytotoxic drugs, follow the manufacturer's order on temperature control. Some might want to chill in the fridge, while others may prefer to get cozy at room temperature. Next, make sure to tag all your containers and storage pot with the name of the cytotoxic drug, its potency, and any special handling tips. Plus, don't forget to jazz it up with some funky color-coded labels to match the rules of the house. To dodge any potential spills, try double bagging or use a designated leak-proof container when throwing away cytotoxic drug waste. It's like adding an extra shield of defense. For transport, make sure the specific cytotoxic drugs are transported safely to their designated dump site. And as for hazardous material regulation, remember to keep it local. Last, keep those records on point. Jot down the details on any cytotoxic drug waste disposal, like what and how much waste, when it was dumped, and any other need to know intel for audits and following rules.
Next is reconstituent procedure for cytotoxic drug. First, healthcare profession must wear PPE and work in a controlled space such as laminar flow hood or biological safety cabinet. Secondly, they check the drug for damage and confirms its details. Third, the necessary dose is then calculated based on the patient needs. Fourth, the drug is prepared by injecting a clean liquid into its vial and gently swirling it. After settling, the ready drug is carefully drawn into a new shrink. Then, important details like the patient names and doses are labeled, and the process is documented. unused materials are disposed of safely. Lastly is a final check. A final check is ensure everything is accurate before removing protective gear and washing hands. Following specific guidelines is crucial for safety in this process.
So in conclusion, the reconstitution of cytotoxic drugs plays a vital role in guaranteeing their therapeutic effectiveness with mitigating possible risks. Adherence to exact reconstitution protocols, the enforcement of stringent safety measures, and also compliance with appropriate storage and disposal guidelines are crucial for preserving the integrity of the drugs and ensuring the safety of patients and also healthcare professionals alike. The importance of these practices cannot be emphasized enough, as they significantly contribute to overall efficacy of cytotoxic drugs therapy, underscoring the need for careful attention to detail across the entire drug management process.